Dr. Bob, my doctor says I have PAF. Well, PAF is paroxysmal, that means intermittent, atrial, that's part of the heart, fibrillation. So it's atrial fibrillation, but it comes and goes. And there's a natural history of that where it may just be just little, it makes you feel like somebody said boo, and then it will last maybe 30 minutes. And then 3 or 4 months from then, it may last 30 minutes. And then it may last an hour. And the time intervals become longer and longer that the irregular rhythm occurs, and the time interval becomes shorter and shorter, to where eventually, once a week, it may last for 7 hours. Prior to that, it usually goes away on its own. After it gets to be where it occurs weekly for 7 to 12 hours, person needs to be on a blood thinner, and we need to talk about treatment. The treatment for that, intermittent atrial fibrillation getting more frequent, the history is going to be eventually it'll just be long term. So at this time there can be cardiac ablation. Now, ablation means where they'll do a heart cath, they'll stimulate the heart, they'll see where the irregular rhythm is coming from, and they can laser that area and make it go away. Now, what they're actually doing is they're scarring down that tissue. And it's at a certain area of the heart. When blood goes to the lungs, it gets its oxygen, it comes back to the heart in the left atrium. That's the pulmonary vein that's carrying blood from the lungs. And it's where that inserts to the heart, where most of the irregular rhythm, the atrial fibrillation, starts. So if they can laser that area, they can scar it down, then it keeps it from occurring. So that's the way it's treated if you've got paroxysmal atrial fibrillation. The first time they do the ablation, 85% chance they'll get it to go away. If it doesn't go away with the first ablation, almost always the second time, and you've got a cure. You have to find it, has to be the right person, the right time, but know that that treatment is successful. Well, that's all the time that we have for this show. I hope you've enjoyed it as much as I have. Remember, let's keep away from all those troubles like strokes, like atrial fibrillation, by exercising. Exercising helps protect the heart. It gives collateral circulation, it reduces blood pressure, it makes you feel better. You'll get a runner's high.